Alrighty, we are back and chatting a little bit more about some hypertensive meds that lower blood pressure that are cardiac meds. I'm using my quick facts for the NCLEX guide here, and today we're talking about ACE inhibitors, so our pills. And when you hear ACE inhibitor, if you've taken a pharmacology class, I hope the first thing that's coming to your head is angioedema, which is a life-threatening side effect of this medication. If a patient ever presents with it, we should be marking it as an allergy and they should be coming off of that med immediately. But let's chat a little bit more in depth about them. And if you work in the clinical setting, let us know how you're seeing these used and what information I'm missing down below. But some drugs that end in pril, your lisinopril, captopril, and enalapril are some of the more common prils, but lisinopril is going to be the most common one you're going to see. And basically what they do is they block the enzyme that converts angiotensin 1 to angiotensin 2, which is a super powerful vasoconstrictor that will increase blood pressure. So by blocking this, the blood pressure is not going to increase. And it also causes the secretion of an additional blood pressure elevating hormone in the adrenal glands called aldosterone if converted. So it's also blocking that process, which is going to lower blood pressure long term. And then some things that we should keep in mind is that the African American population of patients are at a higher risk of developing angioedema while on this drug. And then with that, it is common for patients to get a dry hacking cough. So we should educate them on that being a side effect. And we should also not give it to a patient that has had a history of angioedema in the past or renal impairment, because this can be a little bit hard on the kidneys because it can increase potassium levels. And we should also avoid these during pregnancy. So let us know if you're in the clinical setting, like I said, how you're seeing these used and what information I missed down below. And thanks so much for being here.